Maggie Frost here with you without my 9 o'clock partner, Jay LeSueur, who I pushed out the door and said, go take a couple of days off. You need it. But that's okay, because joining me now on the phone is what I consider to be almost an old friend here, based on all the time he has spent with me on the morning mix, and that would be Dr. Cleamon Moorer. Dr. Moorer, good morning. How are you?
I'm very well this morning. How are you doing, Maggie?
I'm fine. You know, the slightly earlier audience this morning, and I thought you've been with me a couple times. And first of all, tell everyone exactly who you are and American Advantage Home Care.
Well, Maggie, it's a pleasure to be back with you again, as always. To the listening audience, I am Dr. Cleamon Moorer, Jr. I am the CEO and president of American Advantage Home Care Incorporated. American Advantage is a Medicare-certified skilled provider of home health care services. So we send physicians, nurses, and therapists, social workers, and home health aides into homes to take care of homebound patients under doctor's orders all across the state of Michigan.
You know, I'm of the age, two things. I'm of the age, first of all, when I remember growing up, home health care was not it wasn't popular. I don't even think it was, on anyone's radar. For the most part, the nursing home or some type of assistant facility like that was the only option. And over the past 30 to 40 years, it's really grown.
That's right. So back in the day, Maggie, as you just described, there was that great dichotomy between a visiting doctor that made house calls and then, of course, a housekeeper that would come out and do chores and take care of duties in the home. But that skilled home health care brings the two of those dichotomous activities together. So folks could get some skilled care right in the comfort of their home and also get some light chores done by some private duty agencies.
I'm also of the age group. I lost my father last year, but we were thank you. But, we became increasingly aware he really could not live independently anymore. I have a friend right now going through this, and she's really beating herself up because she thought her father was absolutely fine and then became involved in a very serious auto accident. Now, he will recover, but there are negative factors that can affect the aging population that we might not, we might overlook or just not let ourselves see. Is that true?
That is so true, Maggie, and I do empathize as well as sympathize with your friend and her dad. Whether it's an auto accident or just simple aging, in the stages of aging, mobility becomes a little more difficult as we progress in our age and maturity. So having a therapist or a home health aide that could help an aging senior get around, it reduces a lot of the stress that adult children have about falls and the safety of their loved one as they progress in age at home.
I would also think, just talking to some of my friends, the medication management. My dad had one of those. We used to tease him. One of the pill boxes.
The pill box.
Yes,
You
but
got
I mean, it's and he would sit there and count out his pills for the week. We would make fun of him, but I mean, he was proactive. Instead of just having bottles on the kitchen counter, he knew what he had to take.
And think about that, Maggie, just how confusing that is, right?
Yes.
So a Sunday through Saturday pill pack that has perhaps a Monday, each day of the week, but a morning, afternoon, and evening pill. So for some seniors, that's a minimum of 21 pills, right? Assuming that it's the same prescription or the same drug. So the numbers could vary from a minimum of 21 to 50 or 60 or so pills or tablets per week. That's confusing to a young person.
Yes.
let alone a senior, Maggie. So, skilled nurses under doctor's orders can ensure that there is not medication confusion, medication overusage, overdosage, or misuse of medication by ensuring that the senior has the color codes associated with the right medication, because the names of the prescriptions are also equally as confusing
Exactly.
as the daily regimen.
Exactly. And I know a lot of concern is are our parents eating properly?
Nutrition.
Yes.
Come on, nutrition.
Yes.
So, if you're sitting in that lazy boy and you're watching the Westerns, or you're watching daytime television, right? Or you're watching the Golf Channel or History Channel, going to the beef jerky, right? Going to what is most convenient and most pleasing or satisfying becomes the modus operandi for a lot of seniors. So getting in the basic food groups, let alone, enough vitamin D, E, iron, because so many seniors are vitamin D and iron deficient. So, yes, nutrition, having a cook come in or home health aide to prepare meals is another value add of home health care.
And I would assume possibly at some point, and this might not be the case, none of these are really the case with everyone. There's no blanket that covers any aging person. But I would think at times hygiene might also be a problem, and that's important to health.
It is. It's so important to health as well as self-esteem and morale. So, and then as you think about COVID and its lasting effect, there are still some seniors who have lost the sense of smell, right? So, not let alone not remembering, if your senior has showered, or the senior having difficulty remembering, but not even being able to smell a foul odor, which would alert them to say, okay, I got an issue here, or I got a challenge. So, yes, hygiene is important, and there are home health aides that will come in on a daily basis or several times a week to provide a sit-down bath and or shower, depending on the mobility level or the functional level of the aging senior.
So pretty much the family would have a say in scheduling. I know I'm talking generalities here, and we're in a different state.
Yes.
But as a rule of thumb, the family and the senior would have the opportunity to say, I want someone coming in maybe 3 days a week, or I want someone every day.
Yes. So the preference is usually up to the family. In addition, depending on the level of deficit or dysfunction, the physician can write an order that specifies a certain amount of visits per day or a certain amount of visits per week as related to physical therapy or occupational therapy.
The other question that I would have would be as far as, I guess, companionship.
Oh, yes. Yes.
Just to have that contact, even if it's every other day, it does take, I guess, a little bit off of the family and close friends, but it still brings a little new life into the home.
It sure does. So whether it's that certified nursing assistant that's coming in to provide a bath or a shower or toileting, or a home health aide who serves as a companion, or even the skilled nurses and therapists who have the warmth in their heart to say, our exercise regimen is going to last about 45 minutes, but I'm going to stick around here. I'm going to stick around a good 15 to 20 minutes to help you change clothes, help you ease back into your chair, do some reading or watch some television as an added bonus to that visit. So our clinicians get very connected, Maggie. They get very connected to the families that we serve, and we become an extension of that family and a friend, of course, to the patient or client who we are serving.
Has the home health care industry changed in its in its daily operations, do you think, in the face of COVID?
It has, most certainly. So safety protocols are of the utmost importance. A heavier reliance on home health agencies in view of COVID, Maggie, as families are looking at home health care options, more preferably over skilled nursing facilities and nursing homes. So we can anticipate a greater exodus of patients from nursing homes as we go into the fall, which is flu season, and as we assess the impact of the COVID variants. on various high-risk or at-risk individuals.
And I'd have to think and I think we're starting to even see that migration here locally. No disrespect at all to the assisted living or nursing facilities, just a personal preference. I think people listening right now might be going, "This sounds fantastic. How in the world can we afford it?"
Yes, well, the best part about it, Medicare and Medicaid does cover a great deal of the cost of home health care. Private insurance, whether it's a HMO or retirement plan, long-term care insurance also is oftentimes used to offset the costs and the price of skilled home health care. So there's ways, Maggie, to make it affordable to families and decrease that out-of-pocket cost.
I'm talking to Dr. Cleamon Moorer, President and CEO of American Advantage Home Care. I know if I was in the Metro Detroit area, I know who my first call would be. But down here in north central, almost rural Illinois, I think people are also scratching their heads saying, "This sounds great. Where do I even begin to look?"
Yeah, I would suggest, a basic Google search, Yelp or Bing, for skilled home health care in my area. And then I would look at star ratings. Look at the Center for Medicare and Medicaid Services star ratings. A rating of 3 or above is a pretty satisfactory score. And then, of course, references from the local physicians in the area, identifying which home health care providers they prefer. And then Google reviews help, seniorcare.com reviews, agingreviews.net. There are a lot of sources out there, Maggie, that could serve as guidance and support to families who are seeking that much-needed home health care for their loved one.
I forgot to mention you're also a best-selling author. I've got to get my hands on this book.
Oh, Maggie.
Yes.
I'm going to sign one
your
for
college
you, okay?
flunk out. I'd never believe it, seriously. If people want more information and just some more of your thoughts, how can they listen to you or where can they find more information?
Well, Maggie, we do a bi-weekly podcast and webcast titled the Home Healthcare Today Show. So we bring in guests from all over the Midwest that are healthcare experts to speak on a vast array of topics that are most important to families taking care of seniors.
Dr. Moore, thank you, as always, so much information. So good to speak with you. I'm sure we will talk again.
I know we will, Maggie. You enjoy the latter half of the summer, okay? And I'll talk to you in the fall, I'm sure.
All right, you as well. Thank you so much.
Thank you so much, Maggie.
That's Dr. Cleamon Moorer from American Advantage Home Care. The morning meeting continues in just a minute.